Testosterone is often called the hormone of vitality, deeply connected to strength, energy, muscle growth, and even emotional balance. For men, it plays a crucial role not only in physical performance, but also in confidence, motivation, and overall quality of life. However, as the years go by, testosterone levels naturally decline, and this change can bring noticeable effects: fatigue, reduced muscle mass, lower libido, mood swings, and sometimes a loss of drive. That's why more and more men are turning their attention to testosterone replacement therapy, or TRT. But the question is, does TRT really deliver the benefits it promises, and what risks might it carry? In today's video, we'll explore both sides so you can make an informed decision. Testosterone is one of the most important hormones in the male body, produced mainly in the testicles. It's often thought of as the engine that drives many aspects of a man's health. On a physical level, testosterone is responsible for building and maintaining muscle mass, keeping bones strong and dense, and stimulating the production of red blood cells, which carry oxygen throughout the body. It also plays a central role in sexual health, fueling libido and supporting normal sexual function. But testosterone's influence doesn't stop there. It also impacts mood, motivation, and overall energy. When testosterone levels are within a healthy range, men often feel more active, focused, and emotionally balanced. Unfortunately, as men age or due to certain health conditions, testosterone levels gradually decline. Low testosterone, often called low T, can lead to noticeable symptoms such as chronic fatigue, loss of muscle strength, increased belly fat, a decline in sexual desire, and even mild depression or irritability. These changes can significantly affect quality of life, leaving many men searching for answers. That's where testosterone replacement therapy, or TRT, comes into the picture, offering a potential solution for restoring balance and vitality. When men start TRT under medical supervision, one of the first improvements they often notice is a rise in energy levels. Fatigue that once felt constant may gradually fade, replaced with a sense of vitality and drive. Many men report waking up more refreshed, getting through the workday with fewer dips in energy, and finding the motivation to exercise or be more active again. This improvement in daily stamina is often one of the most appreciated benefits. Another major advantage is muscle growth and fat reduction. Testosterone plays a central role in protein synthesis, which is how the body repairs and builds muscle tissue. With TRT, combined with regular strength training, men may notice an increase in lean muscle mass and greater physical strength. At the same time, TRT can help reduce visceral fat, especially around the abdomen, which not only changes physical appearance but also supports better metabolic health. TRT also supports bone health. Low testosterone can contribute to thinning bones, making them more fragile with age. By restoring hormone balance, TRT can increase bone mineral density, lowering the risk of osteoporosis and fractures later in life. For men over 50, this benefit alone can have long-term impacts on mobility and independence. Perhaps one of the most discussed areas is sexual health. Testosterone is essential for libido and normal erectile function. Men on TRT often report a boost in sexual desire and overall satisfaction, which can improve not only their confidence but also their relationships. Beyond the physical, TRT may influence cognitive performance. Some studies suggest improved focus, sharper memory, and clearer thinking. Men describe feeling mentally switched on again, regaining the concentration that low testosterone had gradually eroded. And finally, emotional well-being often improves. Low testosterone has been linked to mood swings, irritability, and even mild depression. With TRT, many men experience greater emotional stability, less anxiety, and a renewed sense of motivation in daily life. It's important to emphasize that these benefits don't happen overnight. TRT is not a quick fix. It takes weeks or even months of consistent therapy to see meaningful changes. And results can vary from person to person, depending on lifestyle factors like diet, exercise, and sleep. Still, for many men struggling with low testosterone, the improvements in energy, body composition, sexual function, and mood can be life-changing. While testosterone replacement therapy can bring powerful benefits, it's equally important to recognize the potential risks and drawbacks. TRT is not a universal solution, and for some men, the side effects can outweigh the positives. One of the most serious concerns involves cardiovascular health. Some studies suggest that TRT may increase the risk of heart-related events, such as heart attacks or strokes, particularly in older men or those with pre-existing heart disease. The data isn't entirely conclusive, but it's a red flag that demands careful monitoring by a physician. Another risk centers on the prostate. Testosterone can stimulate the growth of prostate tissue. For men with benign prostatic hyperplasia or an enlarged prostate, TRT may worsen urinary symptoms like frequent nighttime urination or difficulty starting the stream. There's also ongoing debate about whether TRT could accelerate the growth of undiagnosed prostate cancer. That's why doctors often require regular prostate exams and blood tests before and during therapy. TRT can also affect sleep. Men with sleep apnea may find their condition worsens, since testosterone influences the airway muscles and can make nighttime breathing problems more severe. Left untreated, this can lead to fatigue, cardiovascular stress, and other health issues. Another important consideration is fertility. When external testosterone is introduced, the body reduces or even shuts down its natural production of the hormone. As a result, sperm production can drop dramatically, leading to temporary or even long-term infertility. This makes TRT a poor choice for men who are planning to start on or expand their families. There are also more common side effects. Skin problems like acne or oily skin may develop because of the hormonal changes. Some men experience fluid retention, leading to swelling in the ankles or feet. TRT can also increase the number of red blood cells in circulation, a condition called polycythemia, which thickens the blood and raises the risk of clotting problems, such as deep vein thrombosis. Beyond the medical risks, there is also the psychological factor. Some men view TRT as a fountain of youth, expecting it to solve every problem related to aging. This unrealistic expectation can lead to disappointment or misuse, especially if therapy is started without proper medical need or oversight. The bottom line is that TRT is not suitable for everyone. Men with prostate or breast cancer, uncontrolled heart conditions, or untreated sleep apnea are usually advised against it. Even for those who qualify, TRT requires ongoing blood work, doctor visits, and lifestyle adjustments to minimize risks. So while TRT may restore vitality for some men, it's far from risk-free. Understanding these potential downsides is critical before deciding to move forward. So who is actually a good candidate for testosterone replacement therapy? The first and most important point is that TRT is not for men who simply want to feel younger or stronger. It's a medical treatment designed specifically for those who have both clinically low testosterone levels, confirmed by blood tests, and clear symptoms such as chronic fatigue, loss of muscle, low libido, or mood changes. Without both of these factors, TRT usually isn't recommended. Before starting therapy, doctors typically run a full evaluation. This may include multiple blood tests taken at different times of the day, since testosterone levels naturally fluctuate. A single low reading doesn't automatically mean low T. Physicians also review medical history, screen for prostate cancer, check heart health, and sometimes perform sleep studies if apnea is suspected. Even after starting TRT, regular monitoring is essential. Men are often required to have blood tests every few months to track hormone levels, red blood cell counts, and prostate-specific antigen PSA levels. This helps doctors adjust the dosage and reduce the chance of side effects. Lifestyle choices also play a huge role in the success of TRT. Healthy eating, regular exercise, good sleep, and stress management all support hormone balance and overall well-being. Without these habits, TRT alone won't deliver its full benefits. Finally, men who are trying to conceive or expand their families should be very cautious. Since TRT can reduce sperm production, doctors may recommend alternative treatments to protect fertility. In short, TRT can be life-changing when used properly, but it requires the right patient, the right diagnosis, and careful medical supervision. In conclusion, testosterone replacement therapy can be both a gift and a gamble. For men with genuinely low testosterone, It has the power to restore energy, rebuild muscle, improve sexual health, and bring back a sense of vitality. But at the same time, it carries serious risks, ranging from heart and prostate concerns to sleep issues, fertility loss, and other side effects that cannot be ignored. The key message is this: TRT is not a magic bullet or a fountain of youth. It's a medical tool that must be used with caution, under the guidance of a qualified doctor, and with ongoing monitoring. If you suspect low testosterone, don't self-diagnose, get tested, talk with your physician, and make an informed decision. And if you found this video helpful, please like, share, and subscribe for more science-based health insights.